percent of American adults who are uninsured, we're talking about health insurance here, has dropped from 18% in the third quarter of 2013 to 13.4% in the second quarter of 2014. That is coincident with the rollout of the healthcare exchanges and the massive push to get more Americans enrolled in health insurance programs as a result of the Affordable Care Act. Now, my colleague Dan Witter has done some very, very interesting analysis of the particular states that have dropped the most in terms of the percent who are uninsured. Look at the data there in front of you. You see Arkansas, Kentucky, Delaware, Washington, Colorado, West Virginia. These are at the top of the list of states whose percent uninsured have dropped the most. And one thing that Dan found was that of these top 10 states, all of them were participants in the Affordable Care Act in the sense that they had expanded their Medicaid eligibility limits based on income and also had a state exchange or at least a partnership with the federal government for an exchange related to the Affordable Care Act. Clearly then, it seems that participation in the ACA was a factor in a state's lowering its rate of the uninsured. In fact, he grouped them all, and you see the group data there for states with Medicaid expansion and state exchange or partnerships. The percent uninsured dropped by 4 points. That's about 20 states altogether. For the rest of the states that didn't have both of these conditions, the percent uninsured dropped by about half of that, 2.2%. By the way, what states still have the highest rate of the uninsured? Texas, Mississippi, Georgia. Which states now have the lowest percent uninsured? Well, those are Hawaii, Massachusetts, and Delaware, at least based on our latest rendering. One final point, despite this apparent success of the Affordable Care Act in pushing down the rate of the uninsured in this country, based on our studies of attitudes toward the Affordable Care Act and other research firms, it still remains as unpopular as ever. I'm Dr. Frank Newport, Gallup Editor-in-Chief.